Hi, I'm Dr. Tara Scott. I am one of the clinical faculty for A4M, and I'm so excited to be participating in the Nashville BHRT conference coming up. I myself am an A4M graduate, so I know what it's like to kind of sort through the literature and wonder, about the risks and benefits of hormone therapy, especially in light of breast cancer. So that's the topic that I'm speaking about, and it's a special topic to me because I see a lot of breast cancer patients trying to wade through. Did hormones cause it? Did their own endogenous hormones cause it? Should they take hormones after? And if they're a high risk for breast cancer, should they avoid it or should they take it? So that's a topic that we hear all the time in the trenches in the office. So during my presentation, I'm going to go through the physiology of breast cancer. I'm going to go through estrogen metabolism, which is very important for any patient wanting to take hormone therapy. And then I'm finally going to discuss what do the studies say? What are the risks of the different types of hormone therapy? And what are the concerns with the specific breast cancer patient? So I hope if you haven't signed up, you'll go right now and sign up and join me in Nashville.